Mr. W. is a 66-year-old male patient in no acute distress with a past medical history of hypertension, hyperlipidemia, acid reflux, and a right bundle branch block. Presents to the ED because after a routine appointment with his cardiologist saw that he had a hemoglobin level of 4, called him and advised him to go to the emergency department. Mr. W. also complains of a persistent, non-productive cough and shortness of air on exertion since February, and he complains of generalized fatigue and low energy levels, as well as pounding in the ears and occasional palpitations and heart racing in the past week. He states that nothing aggravates his symptoms except for exerting himself in exercise, and cough drops have helped the cough to help him sleep at night. He is on metoprolol for his hypertension. He claims that he takes daily NSAIDs and has taken them for the past 10 years. And he has a family history of coronary artery disease. His father had a stroke in the past couple years. He denies hemoptysis, hematochezia, melena, nausea, vomiting, diarrhea, abdominal pain. He denies fever, chills, lightheadedness, and denies a history of anemia or GI bleeds, as well as recent weight loss or night sweats. Mr. W. claims that he drinks socially. He drinks 1 to 2 beers a week. He smokes cigars, but not any cigarettes, and he denies any kind of drug use. His vitals, he also denies any kind of bleeding disorders. He denies easy bruising, delayed wound healing, or easy bleeding. He denies any changes in bowel movements or appetite. His vitals, he was slightly hypertensive. He had a blood pressure of 142/77, heart rate of 74, his respirations were 15, and his oxygen was 99% on room air. On physical exam, his lungs and heart were clear and unremarkable. His skin was warm and without edema. It was moist and pink, and his cap refill was less than 2 seconds. His capillary refill was less than 2 seconds in all of his toes and fingers. His nails were without any kind of clubbing or cyanosis, and all of his mucous membranes were moist, pink, and his skin was a good color. He had no pallor. His abdomen was non-distended. It was both tympanic and bowel sounds were auscultated in all 4 quadrants. He had no tenderness upon light or deep palpation. My top differential diagnoses would be pulmonary embolism because of the shortness of air, his cough, because he has a history of hypertension and hyperlipidemia, as well as a bundle branch block. I also think it could be some kind of anemia, either hemolytic or iron deficiency anemia, because of his shortness of air, his generalized fatigue, and because his hematocrit his hemoglobin was so low. I also was thinking GI bleed because of similar reasons: fatigue, shortness of air, low hemoglobin. To rule out a PE, I would perform a chest X-ray, get an EKG, as well as CBC, CMP levels, get a lactate level, and check his coags to look for any clotting disorders. I would not do a D-dimer. To rule out anemia, I would do a blood smear. I would check his retic count, also CBC, CMP. I would look at his bilirubin to look for any hemolytic anemia, and I would, if that didn't show any kind of results or any kind of conclusions, we could do a bone marrow biopsy to look for some kind of anemia due to low production of red blood cells. And finally, to rule out a GI bleed, I would scope him. I would probably do a CT of his abdomen. I would do a guaiac test to look for any blood in his stool, and also check coags, CBC, CMP, and check his titers just in case we had to transfuse him. His lab results, his chest x-ray was clear. He had a normal EKG. His hemoglobin was at a 4.7. His hemoglobin was at a 4.7, and he had a hematocrit of 18. He had a high platelet count at 545 and a low reticulocyte count of 20. His MCV was 62, which is low, which indicates microcytic anemia, and his lactate was a 3.5, which was high. His scope was negative for any kind of bleeds. So my top differential at this point would probably be anemia, because he had negative bleeding, but I would repeat that scope just to check for any kind of bleeds that we could have missed, and even do a capsule endoscopy if that scope was negative as well. I would educate him on his diet, maybe look at any kind of vitamins, supplements that he could take. I would give an oral iron supplement to increase his iron levels and see if that increases his hemoglobin. Emergently, I would do a blood transfusion because his hemoglobin and hematocrit were so low, and see how those go up. And I would also tell him to discontinue his NSAID use just because they increase his chances of developing a GI bleed.